Definitely want to welcome everyone that's here. I'm a part of the American Journal of Surgery STARS committee. Our overall mission for STARS is to make academic surgery more accessible. This virtual seminar series is entitled Roses and Thorns of Academic Surgery. It's an exciting time to be in academic surgery, but sometimes it can appear daunting to reach career goals. And so the purpose of this seminar series is to learn from leaders in academic surgery, hear about their successes, but also their failures and challenges that they've overcome throughout their career trajectory. Hearing this can be reassuring for trainees that are passionate about entering academic surgery. Additionally, this interactive session serves as a platform to connect with a leader in academic surgery. An opportunity that may not be feasible during a national meeting, either because of timing or just like not even having the resources to go to different national meetings. And so we are incredibly excited to be hosting the esteemed academic leader and surgeon, Dr. Paula Ferrada. Dr. Paula Ferrada is a distinguished surgeon, an educator, and a leader in the field of trauma and critical care. Interestingly, Dr. Ferrada had a career in modeling and acting before medical school. Won a pageant, from what I understand, and acted in many TV shows and commercials. For her medical training path, completed medical education in Colombia, her native country, after a year of research at the University of Miami, Dr. Ferrada joined Beth Israel Deaconess Medical Center, a part of Harvard, for surgical residency, being the first Colombian woman to graduate from a surgical subspecialty at Harvard. Dr. Ferrada continued her training in trauma and critical care at the University of Pittsburgh before joining the trauma center at University of Maryland Medical Center as the first acute care surgery fellow. Prior to joining her current position at Inova Fairfax Hospital, Dr. Ferrada was professor of surgery at Virginia Commonwealth University in Richmond, Virginia. Dr. Ferrada's commitment to excellence and innovation is evident in her extensive research, numerous publications, and her dedication to mentoring the next generation of surgeons. From what I could count, over 140 publications. There seems to be a particular passion for ultrasound. Just last year, she published in AJS the phrase, "We've always done it this way," should not be in the way of advancing science and the care of our patients. Let's question the ABCs of trauma. Is prioritizing circulation better when treating trauma patients that are sanguinated? So very interesting research perspective and like kind of challenging the status quo. So Dr. Ferrada has been honored with multiple teaching awards at various institutions, appointed to leadership roles within the American College of Surgeons, the Eastern Association for Surgery of Trauma, and the Association for Women Surgeons. Dr. Ferrada has a very clear passion for medicine and an unwavering dedication to patient care. She is internationally recognized advocate for equity, diversity, and inclusion, and so we are excited to learn from her perspective during this Roses and Thorns of Academic Surgery virtual seminar series. So Dr. Ferrada, take it away.
That was a humbling introduction. Thank you so much, Dr. Williams. I always want to start everything that we do, not only a presentation or a paper that you're writing or a decision to pursue academic surgery or a decision to pursue private practice surgery or whatever is it that you're passionate, and ask yourself why. Why is this important? Because I think it's way more rewarding if we do it for a reason that is above and beyond yourself, or at least for me personally, having just another check in your CV is just not good enough of a reason, right? I think that our why, my why, is serving the patient in need. And this is a picture of how I do trauma. I do trauma, emergency general surgery, critical care, but trauma for me is it basically chose me. It chose me as a career. I didn't choose it. I was 12 years old the first time that I went into an operating room. I had the fortune of having a father that was the chief of surgery in Cali, Colombia, where there was a lot of trauma. Any surgeon in Colombia was by default a trauma surgeon, because we were having to face the warding with drugs in the cartels. And it was super obvious and evident for me from the first time that I scrub in, because there's less regulations in Colombia, right? So you can take your kid to work and put that person in the operating room with scrubs. I think I was like, as my friends described me, a little bit intense. So I think the operating room front desk person got bored with me and fed up, and they just put me in the room. And since then I felt like I couldn't shake it. I couldn't. My dad tried to get me to like dermatology or ophthalmology or something else, but it was just something that I had to be a surgeon. So when I describe to people like, why am I passionate about what I do, is when you have stories of people like, oh, they wanted to be a rock star, or they wanted to be whatever. My dream was to be a surgeon in the United States, and I'm living my dream every day of serving patients through what I do, and I feel that it's my responsibility to help and to support people that have a similar dream. So my big why is the patient. And this is how the patient looks in the United States, with a bunch of resources, right? There's nurses, there's emergency medicine people, surgery people, anesthesiologists, all of it. But that unfortunately is not how it looks in the rest of the world. This is a picture taken in Medellin, but it looks very similar to where I trained medical school in Colombia, South America. And even though this picture looks super poor, I think that what is lacking this patient the most is that human resource. And you will find places like that. You don't have to go to South America to see this, right? You can be in the middle of the country here in the United States, where a lot of trauma happens. A lot of trauma does not happen in level 1 trauma centers and academic centers and tertiary centers. It happens in places where there might be shiny floors and new equipment, but there might not be people that can help the patient that needs it. Our profession is defined by compassion. We're all compassionate towards the patients. But how compassionate are we? Let me unmute this person. How compassionate are we towards ourselves? And how compassionate are we towards our partners? And I talk about this because I feel that we're taught to be compassionate towards our patients, but sometimes forget that we need to fill our own cup and be fulfilled and be happy to be able to not have compassion exhaustion. But also the first type of compassion that goes away is the compassion towards your peers. People that are compassionate, that have compassion towards yourself and towards others, have less chances to be depressed, anxious, or stressed. And this is not me just talking about kumbaya things. This is all like backed up by science. One place where our compassion sometimes is not super evident is when we talk about quality. And I see this a lot. So you go to an M&M, some places better than others. I think surgery and medicine overall is evolving and we're going in the right direction. But in many places, M&M doesn't look how it should, right? Why sometimes you go to a morbidity and mortality conference and you see people accusing other people of not doing something right. It's like we approach things with a lot of judgment and not that much curiosity. And some people do that with the banner of like, oh, I do it, I behave like this, I raise my voice because I don't feel heard, I accuse people, I sometimes I behave the way that I do because I care about my patient. And some people go to blame, there's a saying in Spanish that the finger pointing at the other person, there's 3 fingers pointing at you. because when you start blaming and you know, people, it's not constructive. It leads to a false sense of control, right? If you go to blame first, and you feel that you are like, you have some control over, you're driving it, you found the guilty party, so therefore you can fix it. It allows for people to do some criticism that is not constructive. It leads to contempt, defensiveness, and stonewalling. And it's a discharge of anger, pain, and discomfort. And it's definitely not constructive. Blame leads to, it has an inverse correlation with accountability. And why? Because imagine this, and I know, as I said before, we have changed a lot in residency and in medical schools. I'm not sure how much we have changed towards each other, but the culture of surgery is getting better. But why do I say that blame is inversely proportional to accountability? Because if you're in a place where blame is the first thing that you're going to do when something goes back to a patient, that's when people are going to start hiding complications, right? I have been in programs where there's no M&Ms to present because people are terrified to stand up in front of M&M and actually talk about what really happened to the patient. Because instead of like actually, you know, us responding together as helping each other and understanding that if something goes wrong with a patient in our department or in our division, is all of us responsibility. It's not the one person responsibility. One of us failed, instead of accusing that person, outing them, what we have to do is support him or her, so we can serve the patient better. Shame leads to shame. Blame leads to shame. And how does this look like? So we all are going to feel guilt at some point, right? Brené Brown has this great in this book that is called Atlas of the Heart. She's a social worker that has done tremendous amount of work in research, talking about, you know, shame, guilt, accountability. We're all going to have guilt. And guilt looks like, I made a mistake. So this was not great. I did a mistake. Let me think how I can do it better. Process improves and you grow. So it's a growth mindset. Shame is assuming you're the mistake. And if you think that you're the mistake, then that becomes unfixable. We have to be really, really careful the way that we talked to each other and about each other when the other person is not listening. And also the way that we talk to ourselves, and ways that need to be productive, not destructive. You know, it's very different to say this surgeon made a mistake. This person is an assassin. That person should not work anymore. Different, right? It's very different to say, you know, I made a mistake, I can be better, than completely be shameless, isolate yourself, and let's face it, you know, we are all gonna make mistakes, and our mistakes can result in a change in a patient's outcome. And how do you recover from that responsibility? If you're terrified of failing, if you think that you're going to be destroyed when you actually accept the things that you did wrong, then it's very difficult to improve. And then this shame leads to isolation, stress. Let me admit this person. Isolation and stress. What happens to the human mind when we're stressed out? So we need to be a little stressed out to be able to perform, right? You don't want to be inactive as a surgeon. You don't want to be inactive and lay back, because you don't want to be inactive and lay back when the multiple gunshot wounds come to a trauma bay. You have to have some stress and you have to have some focus, right? And your skills at that time cannot be too democratic, because you cannot take a vote in who's going to open that chest. But if you go a little bit too high, you become exhausted. There's anxiety, panic, anger, and then people start breaking down. And I think that that's one of the reasons why, when we find cranky doctors, among all the doctors that we have, who are the crankiest? And I think the people that have the less communication skills, that get like really upset about things that happen, that have a really hard time verbalizing what they need to do, are generally surgeons. And why? Because we're right here. We're like, it's a lot easier to have emotional regulation when your day starts at 9 a.m., when you eat breakfast, lunch, and dinner, when you don't have 3 cases, they have 10 consults, they're paging you from here, you have to see something else, your patient just died, and you're doing the OR to the epi, right? So I think that the reason why you can find some people being cranky, number one, or lack of emotional regulation. Because people are terrified of failure, number one, but also because we're right here. We are in the mental space of like, I don't need help, I can do it. Working hard is the most important part. In fact, feeling pride of not ever asking for help, and then moving to breakdown. And then people become terrified of failing. There's a perceived danger if you fail in surgery. And I think some of the danger is real, because if you fail and somebody dies, that thing is going to stay with you forever. You're never going to forget when one of your mistakes led to somebody's death. Correct, 100%. And there's a lot to say of how to heal from that. But there are other things that don't require you to flagellate yourself or to be completely crucified in front of Eminem. Like there's some things that are important that you process differently. Fail should be first attempt in learning. As a leader, and I think we all are leaders in our spaces, because leadership is not a title. Leadership is the influence that you have on yourself and the people around you. We have to create spaces for psychological safety, make it explicit that it's okay to fail and you can talk about it without shaming people and making people feel worthless. You can facilitate everybody speaking out. You can establish how these norms are done. We can have new ideas, like you just said. Saying we are going to do this, we're going to do this because we have always done it that way, is the most dangerous phrase in science, period. That's how you stop growing. If you think that you're going to continue doing the things because that's how you have done it. And embrace productive conflict. And what am I talking about here? I know I'm going to trust that everybody that is listening to this talk are not in programs anymore where instruments are thrown at them and people are raising their voices. That's not productive conflict. That is lack of emotional regulation at its best. But if you are respectful with each other, it's important that you're in an environment where it's okay to disagree. There's also something that is toxic positivity. If you're in a place where everything that you say goes and nobody questions it, that's also a dangerous place to be at. I, as a foreign graduate, woman in surgery, my skin is darker, I have an accent, I have yellow hair right now, but this is obviously not natural. I dress differently, I talk differently. I struggle with belonging versus fitting in. At the beginning of my career, I was a lot in this fitting in. I started dressing in black, I cut my hair, I wasn't wearing hoops anymore. And it took a while for me to be secure on my own self, to realize that, I mean, this is who I am. This is what is playing in this channel. And if you don't like it, you can look somewhere else, but this is the channel. This is how it's playing. To feel that a place that I belong in surgery, and it's regardless of how I look and where I come from, this is my space. And I think it's important that we find places where we belong. And that's how we move from equality to equity to justice, where everybody gets the same, everybody gets what they need, to actually just removing the obstacles, right? Because your gender, sexual orientation, the way that you speak, the color of your skin, the things that you dressed at, your accent, those should not be impediments for you to be able to serve the patient and give the patient the best outcome. And when we stop looking at those things, when we get to a world where no more committees and diversity and inclusion need to exist, because now we understand that everybody has value in a place, is when we're going to remove all those obstacles and we're going to be able to serve the patient in need. I think in order for us to get what you deserve, we need to find and help create a place where you can feel where you belong. And what does belonging meaning? Knowing that in a place you're accepted for who you are and you're valued for what you bring. And leaving a destructive environment, which is really hard, especially if you're in training, right? Taking that decision is really hard, but leaving a destructive environment is part of getting what you deserve. it is all about relationships, but those relationships have to be genuine. You can, I don't think that you can be a great leader in academic surgery and a great mentor if you're sounding like a used car salesman. It has to come from your heart. You have to believe it in your heart that it's the right thing. And I think that, you know, I really hope that those times where the boss of the division or the chairman was telling people, I have to be senior author in every article that you publish, I hope that those things are gone. Not only because scientifically that has no merit, and in all the journals is spoken against being good science, but because by helping people, we're also helping ourselves. Not also helping them because it's the right thing to do, it's the right moral thing to do to bring people along. And I really hope to see in the future of surgery that the way that we're measuring growth is by measuring how many people have you mentored successfully, how many people you have helped successfully, instead of how many papers have you published, right? I think is when we start giving a value to helping people that we're going to see, instead of people undercutting each other and trying to compete in destructive ways, we're going to see a better environment in surgery. Also, when you help people, you increase serotonin, oxytocin, and dopamine. It makes you happier. It makes you less chances of having a heart attack and a stroke, and increases self-compassion, improving longevity. And from these objective measurements, the one that I think is the most important is like it helps you create a legacy. So when you help people, those people understand that the right way to advance in either in your institution or in academic surgery or in anything, the right way to advance is by helping other people. And that multiplies. That is not additive, it's multiplication. I think that that's where us as surgeons need to move. As I said before, I believe strongly leadership is not a title, it's about influence over others, our environment, and about ourselves. There's tons, and I encourage anybody. So this is the thing about leadership. You're gonna need to be a leader when you're a surgeon because you're the captain of the ship. It's gonna, like, even if you don't want to, you're gonna have to grow that skill. But that's a skill, like learning how to do a lap appy, like learning how to do a lap chole, right? Like learning anatomy is a skill. And some people might be better than others. Like some people are born with better technical skills than others. However, you have to cultivate the skill. We get really good at what we practice. And I am really concerned that in the majority of the residencies, I don't know in medical school, Lamario, you're gonna have to tell me, but in the majority of the residents, we don't take that much time to teach what leadership is, to try to discover what kind of leadership style is your default. We don't talk about it, but it's something that is so important as a surgeon. Trauma specifically, we are in the trauma bank and you're the leader by default, whether you suck at it or you're amazing at it, you're at it. And you need to have several, right? Because as I said before, trauma bank, no votes. But you cannot be an effective leader and talk to an administrator and get what you want if you're raising your voice and you're demanding things. That is how not to be, and that's how not to last in a leadership position. And how do you do it? By introspection, by reflection. But how do we introspect and reflect if you're waking up super early, going to work, trying to survive, barely having lunch, and then going to bed, and then repeat the next day? It requires time. And sometimes the only time that we have is the time in the shower or the time in the drive. But if you really want to get good at this, you have to dedicate time and introspection to developing the skill of becoming a leader. Discover who you are, really know who you are. What are your strengths? What are your opportunities? What makes you happy? How to triage what doesn't make you happy. There are some things that you're going to have to do in training and outside of training. God knows this happens to me every day. You're going to have to do things that you don't like, but triage triage some of it, because we do really well and we become really good at what we love to do. The most important person that you need to impress is yourself. I read this a few years ago, 2012. It's in Spanish. It says, what would you do if you were not afraid? And I ask you a question because it's never too early to ask. Medical school, residency, or attending, what would you do if you were not afraid? If you were not afraid tomorrow, what path will you go? Because the path of being division chief and then chairman and then dean is a path that somebody else invented. And it's a great path for the person that invented that, but it is really your path. And should the definition of success of somebody else, should that dictate what's the definition of success for yourself? And I don't think so. We're constantly being measured by other people's rules, and we constantly being measure ourselves against those. And of course, then you're going to be unhappy because you're never going to be able to reach somebody else's dream. Everybody's path is different. When I get a little lost, I have this in my office. When I get a little lost, I look at this and I look at what are your purpose, what you love, what you're good at, what you get paid at, what the world needs, and in the middle is your purpose. And whatever is not like in that square, I try to weed out or give to somebody else, because time is the one resource that we cannot get back at. From these four things, the most important for me is, what do I love? Because I said before, you do excellent what you love. More importantly, things are gonna get hard. There's no way around it. Medical school is hard. You're gonna have to study super hard. You're gonna have to sacrifice a lot. And you always think, oh, there's a light at the end of the tunnel. But that light at the end of the tunnel is residency. And you're going to work hard. You're going to be overwhelmed, especially as an intern. And it's going to get difficult. You're going to miss family gatherings. You're going to miss birthdays. You're going to have to move to another city. It's overwhelming. Okay. So, but how is it that people are successful at overwhelming things? By not quitting. People don't quit what they love. So do what you love. And then I love this slide because I think we all need to start thinking about, who do you want to be, right? And I'm talking about this from every perspective. Division chief, you want to be the leader that pulls the mission, not the people that are bossing people around. But that also goes from intern to medical students, from second year to interns, from chief to residents, right? Because we are giving leadership roles, even if you want it or not, or if you're trained for it or not. Are you going to be somebody that gives credit, or are you going to take the credit for everything? Are you going to inspire fear, or are you going to generate enthusiasm? So I know this slide is odd, but what do all heroes have in common? And I'm going to just give you a hint. It's not the cape. Also, it's not the gender. We all, like, if you read every story or watch every movie, the Hunger Games or whatever, the leaders, the hero starts as a status quo. Hero is not a hero yet, normal person. Then somebody asks them to go for adventure, probably to save, I don't know, the town or the sister or whatever. Then you run into a mentor, and the mentor helps you and gives you an idea of what to do, a path of what to do. And then that person that was not a hero yet start getting into the path. And there's a bunch of difficulties, right? You have to slay some dragons. It's going to get hard. Sometimes you start wondering, oh my God, was this a mistake? I might not be made for this. And then that hero goes into a crisis. But if you persevere and go through the crisis, then you win. And then you become the hero of your own story. And then all of a sudden, the dragons that were trying to eat you, they become in your transportation media. And this is not only in the movies. It's not only Superman or Hunger Games or whatever. This is life. This is what happens when you go to high school. What happens when you go to medical school? What happens when you go to residency? And the key of actually getting from resolution to be the hero of your own story is perseverance. Don't quit. You think life is terrible right now? Take a nap, eat some chocolate, go for a run. It's going to be better tomorrow. I cannot emphasize it enough. You look at the world, right? Even like the Steve Jobs and the people that they all have hard times. And you see the common denominator is not quitting. Don't quit when it gets hard. I didn't invent this. This is a book of Joseph Campbell, which is The Hero of 1,000 Faces. I recommend it to everybody to read. We all need to fall to get up, to learn how to get up. The mindset of not wanting to change, the mindset of like, I cannot do this, that's something acquired. Society put that on in your brain. Because if we were born with that, then there will be a bunch of people in wheelchairs. What happened to your son? Oh no, he fell. It wasn't for him. No, that is something that society has made for people to be afraid of trying. You have to make mistakes. We never lose. We either win or learn. As a surgeon leader, we all have to have clinical and technical acumen. Otherwise, nobody's going to follow you. Nobody's going to believe you. So for everybody, for all the students that are not going to residency that want to be at some point the boss, or the residents that are listening to this, or the attendings that are listening to this, you have to be a good clinician. That's a must. That is what we promise when we graduate from medical school. That's what we promise every day when we decided to be residents. This is it. If you cannot serve a patient that needs it, then I don't think that much of anything else matters. I saw this in a post of social media, and it was like, oh my God, to be a doctor, you have to and be successful. You have to disappointment, persistent, hard work, huge risks. And you know what? I have a news flash. This for everything. You want to be a good mom? You're going to have to do this. I know it by experience. You're going to be a good partner. You're going to be, you're going to quit medicine because it got too hard and you didn't persevere. Whatever you go, if you're going to be successful, this is everything that you have to, this is life. So we have to earn it. In order to get what we deserve, we have to earn it. And because it's not easy, it's critical that you have a support system. So, family, I unfortunately don't have family close. Things, the world is getting smaller, and now I can talk to my parents every day, but there was a time where that was not possible. But if you don't have your parents close, your brother, your sister, but your co-residents, your co-students, your partners, those become extension of your family. And that's the people that are going to pull you out when you need it the most, right? Do not isolate yourself when you're going to difficult times. You're not alone. We're all going through this, and everybody that has graduated from general surgery had to go through difficult times during training. I don't know one person. And as you accumulate these allies, you create an army of people that we all want the best for each other. Getting what we want is simple, but it's not easy. Simple because you have to make the decision, but not easy because you have to persevere. And perseverance can get harder and harder and harder, right? If you hold a bottle of water for 5 seconds, it's not heavy. Hold it for 20 minutes and see how it is. And that's what it takes to be successful. I also feel it's important that we don't resent people that are successful, right? And I don't think, nobody in surgery taught me this. My mom taught me this. Don't envy is like, even though it's a human, envy and jealousy is a human feeling, it's not healthy. Instead, surround yourself by people that are smarter than you. Surround yourself by people that are doing better than you, because we all grow from it. And I think happiness and success is contagious, but also the other way around. I think negativity is also contagious. So what side do you want to be on? I want to be in the happy side. I want to be in the side full of gratitude and light. Collaboration is a new competition. We all can do this together. This is the hardest one for me. Are you comfortable having enemies? Because I had, not anymore as much, but I had these feel or need of pleasing people and making people happy. And I think part of it is whatever happened in my childhood, but I think it's also part of what happens in medical training, right? Yes, in medical school, there's tests, but the majority of your grades are based on pleasing somebody else and making sure that person thinks that you're good or bad. And when you go to residency, it gets worse. We are taught basically to obey, right? It's a little bit of psychological manipulation. You don't eat, you don't sleep. So then your conscience and your will gets a little weaker, and that gets replaced with whatever they're feeding you. So you're almost cannot take any decision other than the one that it is to please your attendings, so you can have a good grade, so they can think that you're good, right? And that creates obedience. So once you finally graduate and you have to take your own decisions, sometimes people don't know how to do that. And we are stuck in a place where you want to be like a little puppy that everybody loves, but that's not compatible with humanity, and that's not compatible with integrity. Because if you believe in something, at some point somebody else is going to disagree, and some of these people are going to disagree and have healthy conflict, and some people are going to disagree and not have a healthy conflict, right? I think all the winners in life, in surgery and academic surgery, but in lives, are going to have haters. And, I do a lot of things online. A ton of people sometimes send mean comments, and you have to be okay with that. This is a lot easier to be brave behind a screen. Nobody's going to tell me that to my face. I prefer somebody tell me to my face, and we have an actual conversation that will be enriching, and I will learn a lot, and that person probably will learn a lot as well, but is not how it happens sometimes. So you have no enemies, you say. You hit no traitor in the hip. You dash no cup from perjured lip. You never turn the wrong to the right. You have been a coward in the fight. And we have to be brave. When you stand for something that you believe, because of Disney and because of everything that we experience, living life, you think that people are going to get up and clap. And that's so far out from the truth, right? People sometimes don't want to compromise. They don't want to show exactly what side they are, because strategically they're keeping those cards close to the chest. But I think that in order to have integrity and live a fulfilled life, you have to be brave. You have to take the jump. You have to stand for what you believe. When you learn who are your enemies, if you think you have no enemies, you're in a really dangerous place right now, I'm telling you, because you do have enemies, you just don't know who they are. When you learn who they are, learn their motivations, their history, their desires, shortcomings, and their relationship with each other, see if you can try to change their mindset. In my experience, people that are really contrary to you are people that feel unseen. So if you help those people be seen, if you give them a branch at olive tree branch, that might help them. That might help them and might help you, because the best way to destroy an enemy is to make him a friend. So to get what we deserve, we need to find our why, whether if it's academic surgery or general surgery in the community or anything else. Why are you doing what you're doing? And that why needs to be deep. It needs to be personal. Understand and manage your environment, the good, the bad, and the ugly. Dedicate time to introspection. And people maybe say introspection. Some people say praying. Some people say meditating. Whatever is it that you use to actually have some introspection. Focus on your happiness. We do better what we enjoy doing, and everything in life. Precisely the difficult times. Everything in life is an opportunity. Nothing about being a surgeon or being an academic surgeon or being successful in life is easy, but everything about it is worth it. And we all define success differently, right? That's the beauty of it. You can be a hero of your own story. You're probably already a hero of your own story. Thank you so much for your time, and I take any questions.
Thank you, Dr. Ferrada. That was a very invigorating talk that you gave. I love everything that you were talking about. We'll open up to questions, but I'll get things started with a question of my own. Everyone can feel free to either ask a question in the chat or raise their hand. But I'll ask Dr. Ferrada, what is one of the biggest challenges that you face of being in a leadership role, seeing that you've been in several different leadership roles? I guess what kind of anecdotal experience do you have of kind of, I guess, the more difficult parts of being a leader?
I think there's tons of challenges, but I think one challenge I think that we all share is time management. And I discovered that more than time management is energy management, because you can have a bunch of time, but if you're exhausted or you're distracted, you're not going to get anything done. So I think to overcome that, I put myself deadlines. I did internship in 2001, but I never really got over being an intern. I'm a great intern. I have my check marks. When I accomplish something, I also read somewhere that when you check a point, it increases your dopamine, and dopamine gives you more energy than do things. So I think that's how I overcome it. I'm also unfortunately addicted to chocolate, as I mentioned it before. I eat a lot of chocolate, and that also gives me energy.
Hi, sorry. Hi, hi, thank you so much for this talk. My name is Karen. I'm a current second-year medical student, and I wanted to ask, I feel like for me, sometimes navigating the hierarchy of medicine as a student, and interacting with residents and things can be hard. So I wanted to ask what your advice is for doing that, but also not losing your personality and falling into that fitting in versus belonging.
Right. This is what so I have read a lot about vulnerability, and I know we're not great at being vulnerable in medicine and in surgery, but in my experience, sharing vulnerability with people goes a long way, because we are all deep inside human, right? So it's a lot easier to ostracize somebody, or to point fingers at somebody, or to isolate somebody, if that somebody is a name, or not even a name, a person that just fills in. If they know you by name, they know you by history. We have those opportunities. So I take sometimes for me, going into a lunch with a partner is as important as meeting with the CEO, because those times of interaction, and also take opportunities to interact with people outside of the hospital, it humanizes us. And it's a lot more difficult to be mean to somebody if that person is depersonalized, if that person is not a person to you. It's a lot more difficult to be mean to somebody when you have shaken a hand.
Isaiah, did you have something you wanted to ask?
Oh yeah, I'll say it out loud. Good afternoon, and thank you for sharing with us. Um, Basically, I was just trying to see, as somebody in your position that's climbed the ranks, do you find it hard to have a work-life balance?
Yes. I don't think that anybody, never mind. If you find somebody that says, yes, I have an amazing life balance, just I want to learn how that person did it. So yes, it's hard. And I don't believe really in balance, because I think balance implies that I'm taking from here to give to here, right? I believe, and for the good or the bad, I'm telling you my honest opinion. You decide if you want to follow it or not. I am a deeply unbalanced person. When I'm at work, I'm 100% at work unless my son calls me. My son has a special dispensation for anything he needs. But I am deeply into what I'm doing. I almost never multitask. I can serially task, but I'm 100% into what I'm doing at the time. And then when I'm at home, I try to be 100% of what I'm doing with my family. I think being in trauma has allowed me to do that, because I don't have to carry a pager, right? It can hit the fan tremendously when I'm in the hospital, but nothing can stop the clock. That doesn't mean that you cannot do it in other specialties. I think that we all have different personalities and different ways of managing it. But no, I let me just say, I try my best every day, and I think my family knows that I'm present for them. But I struggle with balance. I don't think I have it. I don't. I think somebody else raised their hand, but I didn't see who.
I can ask another question.
Okay.
One. Um, Could you talk about global surgery and some of the hurdles you may have faced with trying to advocate for surgery in countries outside of the United States?
Yeah. Oh, so you're talking about global surgery or what type of hurdles?
Yes, for global surgery.
Well, so many hurdles. So I think because I had such a hard time, I'm a foreign graduate. It took my unborn child to get a spine surgery. A lot of things happened during that time, and I think I still have a little PTSD from it. I think that for me it's critically important to make sure that residents and students get treated fairly. And I learned in things in the United States, you have ACGME. In Latin America, they don't. So all the things that we had to put up with and people before me that were never acceptable, but now people don't do them because they either get fired or it ends up in Twitter. Those things, the throwing of the instruments, the calling people names, all of that still happens in Latin America. And it's deeply important for me to try to help them and change the environment. And it's difficult because Latin America is not one country, right? Every country, some countries are better than others, but every country has their own idiosyncrasies. Then I think global surgery is kind of, I know you're interested in that, Lamario, but global surgery for me is more international surgery than global. Why? Because you're not a global surgeon of the world. You're going to have to create alliances with that specific region. And that specific region is going to have different issues. Some people have problems with primary care. Some people have problems with supplies. Some people have problems with access. And so you're going to have to pick where you're going to go and then manage the hurdles as they come, keeping a mind open that you're going there as much as there is to teach than to learn. If you go there thinking, oh, you're from the United States, so you're going to go to a place to teach them how to do things, that's not going to go well, and it's not going to well receive, and you probably are going to end up not in a great situation. I also don't believe in surgical tourism. So if you're going to go to a place to help, don't do things unsupervised that you wouldn't do in the United States, because patients everywhere deserve the best care. And make sure that you follow up, that you have a relationship with somebody that can tell you, how is the patient doing and such. And then there's other types of collaboration. You can do collaboration through research. You can do collaboration through policy creation. There's a lot of room for us to grow together. And I think in general, if we can unite forces and have the skills that surgeons have in places where they have to work with nothing, and the research that we have in the United States, where we have these incredible resources, we will be unstoppable.
Anyone else have any questions? Because I can think of more.
I'd love to ask a question, if that's okay, Lamario.
Of course.
I loved just the discussion of having compassion for our peers. I think that's definitely something as residents, you hear people complaining about, whether it's your senior resident, your junior resident, the nurse, whatever. What are some ways that you kind of catch that in yourself and, try to prevent yourself from kind of having that compassion fatigue? And is there a way to kind of call in others who you see are kind of lacking that compassion in a way that's not, condescending and just escalating the situation further?
Yeah, no, that's great. Well, I think that the best way to be compassionate to others is to catch also when you're not being compassionate towards yourself. Because as I said before, emotional regulation is much better when you're not starving, when you're not dealing with 3,000 emergencies, and when you're not out of not having any sleep for 36 hours. It's all situations where I have been. And I think when you're in a situation where your response is not going to be great, if you know yourself, you're going to feel it, right? Some people feel when their heart rate starts increasing. Some people see red. Some people, you know it, you know your body. When that happens, pause and try to take your mind to something that is not unpleasant. Physically, what do I do sometimes when I feel myself that my heart, that somebody said something offensive and I'm this close to react? I Valsalva, because that increases your vasovagal. Or sometimes I rub my neck, and nobody thinks that this is like anything weird, but carotid massage will decrease my sympathetic response. And then how do I catch it from doing it? I have been guilty in the past when I was when I was a resident at the time. There were things that were not super benign in my program, and everybody was measured by that, by just like the strongest is the person that is the most resilient, and the people that were making mistakes were ostracized. I catch myself now because I realized that that nobody grows in that environment, and that doesn't help the patients when you do that. And anybody can be in the receiving end at any point if you're in that type of culture. So I think the key is to approach things with curiosity. So instead of judging immediately, this is bad, this is good, this is wrong, this is right, just pause for a minute and ask questions, right? When somebody says something offensive, like if somebody says something offensive because I'm a woman, or like sometimes it happens, instead of judging, this person is racist or this person is misogynist, just ask questions like, do you really mean to say this? Or tell me more about that. And then you start learning more about that person and more about the intention. I think it's also important not to assume evil, because I don't think nobody shows up to the hospital to kill someone, right? We all go to medical school because we want to help people. So assuming good intent is really useful. And how do I point these in others without being disrespectful and without making people angry? With the same approach. Tell me more. That I'm a division chief and I have the opportunity to mentor, before I mentor my residents and my fellows as a fellowship director, and now have the opportunity to also mentor my faculty. I think that you praise people in public, but you have to call people for attention. You do it in private. And I always ask a lot of questions and be willing to listen. I think sometimes we are listening just to respond, right? No, but compassionate listening, really listening, because you legitimately are curious about what the other person has to say.
Dr. Ferrada, you mentioned that we should strive to measure growth by the people that we mentor, or the people that we're able to contribute to their success. As trainees, a lot of us being trainees on this call, what advice do you have for finding quality mentors and or sponsors?
I think the first step is when you find somebody that reflects who do you want to be in 5, 10 years, 20 years, reach out and ask. I think the majority of the people will feel honored that you were able to, that you're asking for mentoring. And the people that don't want to mentor you, then at least you don't waste your time. There's many mentoring programs through many societies, but I think the best chance of having somebody that's successful is going to help you is just reaching out.
Would you be able to expand on your discussion earlier of guilt versus shame, and some of the ways that manifest in the ways you talk to yourself primarily, more so than to others?
Yeah, so we all have inner dialogue, and whether you want to recognize it or not, we all do. Interestingly, negative inner dialogue is more common in women and minorities. It is. So then how do you do it? You do it by by catching yourself when you're, you know, treat yourself like you would treat a good friend. Do not say things to yourself that you wouldn't say to somebody that you deeply care about. Because this is gonna sound maybe a little selfish, but the relationship that you have with yourself is crucial for happiness, for self-esteem, for being successful in anything that you do. And as I said before, that we get good at things that we practice. If you practice putting yourself down, how are you going to be successful in anything if you don't believe that you can do it? And so I think, yeah, not shaming others, but specifically not shaming yourself is crucial. I mean, I think it's good to surround yourself by people that are going to help you with that and that can center you. But there's no replacement with with coaching yourself. Like that introspection and that capacity of having your self-compassion and stopping yourself from negative dialogue, nobody can do that for you. Ultimately, you need to get to a point where your self-worth is not attached to other people's beliefs, where your self-worth is not attached to a score in a test, or your self-worth is not attached to how many likes you have in something in social media, that your self-worth comes from within you. And that is a very different journey for every person.
Dr. Ferrada, thank you so much for speaking with us and offering your insight and your wisdom. This hour has been like so reflective. I've really enjoyed listening to you and learning from you. And thank you to everyone else that has joined the call. This will be available. This session will be available online on our YouTube and our social media. So hopefully others can benefit from your wisdom, Dr. Ferrada. So really, really appreciate you taking the time to speak to us tonight.
Thank you all. Have a good night, everybody.